Hey y'all, it's the nursing professor here to talk to you about two super important things that you need to know when we're talking about pharmacology. So it's one thing to memorize all the drugs and have some ideas of what they do and the side effects and things like that, but you must understand two major concepts because a lot of questions are centered around you being able to understand these two concepts. So this video is really very important for you. So the first concept is pharmacokinetics, and that's where we're looking at how the drugs are processed by our bodies, how it's metabolized, how it's absorbed, and all those different types of things. Pharmacodynamics is where we look at how these medications achieve their desired effect. For example, if you take Aleve, you got a headache, you want your headache to go away. And so we want to be able to differentiate that. We want to be able to identify the difference between the two. Hey y'all, this is the nursing professor here talking to you today about pharmacokinetics versus pharmacodynamics. Two very, very important concepts you need to note as you study for your final exam. All right, so in pharmacokinetics, we're talking about how the drugs are processed by the body, and there are four keywords that we need to be familiar with, and I remember them by remembering the acronym of ADME. So A is for absorption. That's how the drug passes through your bloodstream, like if a person should take the medication on an empty stomach or not. Distribution is how that same drug moves throughout your bloodstream to get to the appropriate tissue. And so if you have a person who has impaired circulation, that could possibly have an impact on the distribution of the medication. Metabolism is the physical and chemical processing of the drug that undergoes in the body. And so typically that occurs in the liver and the small intestine. And so again, thinking about if something's wrong with your liver or small intestine, it may impact the way the drug is metabolized. And the last step would be excretion, because all of the medication is not good for us. We have to eliminate waste, just like we do with any type of food. So in excretion, we're eliminating waste products after the completion of drug metabolism. If a person has kidney damage or failure, then this might be quite impactful because their bodies might be unable to excrete the excess waste product. Then we also have significant influences, which include age, weight, gender, kidney function, liver function, and when we talk about gender, it's a significant influence because women get pregnant. Women have hormonal changes, they have a different distribution of body fat, and that can be quite influential on medication management. Some other nursing considerations include synergism, potentiation, and antagonism, and you should know the difference between the three. So when we talk about synergism, we're talking about how one drug helps the other drug work better. Like, for example, if a person has a cardiac problem and they're taking simvastatin, which is a drug to lower cholesterol, then, and along with that, they're taking gemfibrozole, then that's going to really help improve or decrease their risk for cardiac disease, because one lowers cholesterol and the other lowers triglyceride. And we know between the two, both of those could be quite dangerous to our cardiac system. When we talk about potentiation, we're talking about two drugs where one drug prolongs the effect of the others, and sometimes we want that. And so in the case of penicillin, if we had a patient that was on probenecid, which is an anti-gout medication, it can actually slow the rate of excretion, and so the person will have a longer time for the medication to be in their system. And antagonism is probably one you're most familiar with, and it's just drugs that have opposing actions. The most common one that we know about today is Narcan, because Narcan is used to go against narcotics. And so it can easily help a person who's having a drug overdose. So Narcan is used quite frequently. We always want to observe for drug interactions and adverse drug reactions, because those are things that we do not want to have a patient experience. And then half-life. This is a super important concept to understand. It is when the initial concentration of a drug in the body is reduced by half. So generally, a drug that has a short half-life leads to increased frequency of administration. For example, if your drug that you're taking has a half-life of 4 hours, then in 2 hours, you only have half of the drug left in your body. And so if the idea is to keep the body with 100% of the drug, then that drug might have to be taken more frequently. So you think about things, drugs that are prescribed like every 4 hours, every 6 hours. Now, a longer half-life is associated with decreased frequency of administration. So these many times are your medications that are given every 12 hours or every day, just once a day. And typically when you have patients that have compliance issues, then giving them drugs that have a longer half-life is the best choice because they only have to take it once a day or 2 times a day at most. Then we move over to pharmacodynamics, which is usually an easier concept to understand, and it's how the medications achieve the desired effects. And we have both primary and secondary effects of medications. So when we talk about primary effects, we're talking about palliative, meaning pain management, supportive, meaning things like antibiotics, substitutive, which would relate to medications that replace body fluids or chemicals such as insulin. And we also have restorative effects, which would be those things that we take in order to retain or maintain the body's health, like vitamins and supplements. Secondary effects are also things that we're quite familiar with, and those would be your side effects. Many times they're unintended and often unpredictable. For example, certain medications cause constipation, dizziness, or diarrhea. And when we know that we're administering our patients these types of medicines and these might be possible secondary effects, we should let them know that. Adverse reactions would be when a person could be given too much of a medication if it's dose related. For example, we know insulin is very sensitive, so much so that it takes 2 RNs to check to make certain that the correct dose of insulin is administered. So, of course, if you gave too much insulin, then the person definitely is going to have an adverse reaction. Narcotics, sometimes people report being really, really drowsy, sleepy, difficult to wake up, itchy. Itchiness comes a lot with morphine, and so that can make a person feel awful. Toxic reactions go back to half-life. If the kidney isn't functioning well, you're going to have this buildup of waste that should be excreted, but the kidney is not functioning, and so it'll just continue to build up. And of course, allergic reactions, and unfortunately, we don't typically know about an allergic reaction until the person actually has one for the first time. Then we need to know the difference between parenteral medications. These are medications taken by mouth. These are medications that are digested versus injectable IV medications or medications that are administered with some sort of needle, be it a needle that just goes in and out or a needle that stays in a particular place. And so when we talk about injectable meds, we're talking about medications that are administered intramuscularly, which is in the muscle. Most frequent type would be vaccines. Subcutaneous into the fatty layer. Sometimes that's insulin or blood thinners like Lovenox or heparin. Intradermal would be directly underneath the skin, and typically the most common one would be administering a tuberculin injection to a patient. We also administer medications in the epidural space, and I see that spelling is incorrect. That's when a catheter is put in place and medication is placed into that catheter. Most common place is that a person gets an epidural for some sort of surgery, including childbirth. Intraosseous, when medication is injected into the long bones, frequently this happens during an emergency when an IV access cannot be obtained. And topical, of course, is just right on top of the skin. It can be delivered in ointment, transdermal patch, creams, lotions, or liniment. So that is the down and dirty of pharmacology. This is super duper duper important for you to note. Along with this, I would say to memorize some of the most common medications that you need to administer. But these concepts are very, very important when you're talking about answering questions, because a lot of the questions know that most nurses even aren't going to remember all of the drugs and their particular functions. However, knowing the concepts behind pharmacokinetics and pharmacodynamics can be very, very helpful. Also, I would tell you to learn your medicines by classes as opposed to individually, so you'd have some idea how to answer questions. So that's it for now. I will see you next time.